This is the pre-dental program at Eastland Career Center. Hello, our names are Grant and Tomia. Today we'll be showing you the four-handed dentistry as well as oral evacuation.
What you are seeing here is a cassette with different types of dental instruments. These are all the materials you need for instrument transfer and oral evacuation. PPE, cassette with instruments, gloves, HBE, and Dexter, your patient.
Before we get started, you must remember to put on your proper PPE. This includes gloves, safety glasses, face shield, lab coat, lab shoes, and the KN95 or N96 mask. The dentist's hand should never move 6 inches away from the patient's mouth. The operator zone for a right-handed dentist transfer is 8 to 12 o'clock and 12 to 4 o'clock for a left-handed dentist transfer.
As you can see in the picture. For transfer of the instruments, you want to place your finger T1 and 2, which are the thumb, pointer, and middle finger, on the opposite end of the end that is used by the operator. Instruments should be held with the working end towards the tooth being treated. When receiving an instrument from an operator, you should use your pinky or finger number 4 to grab the end.
When placing the instrument in the dentist's hands, make sure your fingers are up on the shaft of the instrument to make sure the dentist can get a good grab on the instrument. You want to put some force behind it as well as to make sure the dentist has hold of it so it doesn't drop to the floor and become contaminated.
There are different types of grasps when handling the instruments. There's modified pen grasp, palm grasp, and palm thumb grasp. Modified pen grasp is held with your thumb, index finger, and middle finger, but the middle finger's pad is held against the shank of the dental instrument. Your ring finger acts as a finger rest.
In palm thumb grasp, the instrument is held firmly in the palm of the hand, with the 4 fingers grasping the handle while the thumb is extended upwards from the palm. This grasp is used in the instrument having a straight shank and blade, such as a straight chisel or a Wheatle step chisel.
Palm grasp is when the handle of the instrument is held in the palm of the hand and fingers grasp the instrument. Make sure that you have all your PPEs on while doing a procedure. To set up the HBE, you want to put the HBE tip on and push a lever all the way down to turn it on. We use HBE to clear debris out of the mouth and control oral fluids. We use PPE for safety of the operator and assistant.
For a right-handed dentist, palm grasp is used for the left side of the oral cavity. Pen grasp is used for the right side of the oral cavity, vice versa with a left-handed dentist. To determine what tooth surface to place the HVE depends on what the dentist is working on. If the dentist is working on the buccal side, then the HVE goes on the lingual side, and vice versa if the dentist is working on the lingual side.
If the dentist is working on a posterior tooth, you want to make sure that the HVE is towards the back of the mouth. If they are on anterior teeth, then you should be close to the tooth, but make sure at all times you're not in the way of the operator's instrument or site of the tooth. After the procedure is over, you want to make sure that you evacuate the water lines. You do this for 1 minute between every appointment and at the end of the day. We do this to clear out and disinfect waterborne microorganisms and remove biofilm.
A good representation of instrument transfer is to use proper technique and safety measures. A bad representation is passing the instrument with the wrong end facing the dentist.
We do instrument transfer to help make the procedure go smoothly. These are several ways instruments may be transferred between the dentist and the dental assistant. That is all, guys. Thank you for watching our video.